Hi, my name's Peter Viola, and I'd like to discuss the medical record chart, the tabs, the dividers that are inserted into it, and the forms that are filed behind it. So, to begin, this is a medical record chart. Inside the medical record chart are clips that are in the 1 and 3 positions, which aren't important, but that's where they're located. We have a middle section, which is a expandable section based on how thick the paper medical record is, and for your information, it's called a gusset. So, in putting together a medical record chart, you're going to place the patient's name, the last name first, then the patient's first name, and then we normally color code the patient's first two letters of their last name. In my case, it would be Viola, Peter, and we would color code the V and the I. And that's for retrieval purposes. In addition to that, there would be a record retention sticker. It's a year sticker. In this case, it would be 2014 we would put on it if the patient was seen in that in the year 2014. If they never came in again, we know the date, the year that they were seen was 2014, and normally active files are kept on the shelves for 3 years. So when we would get to the year 2017, we would look to remove any files 2014 or older, 13, 12, etc. So that's where the year sticker is placed, and that's what it's used for record retention purposes. Now, let's discuss the dividers that are placed in here. The dividers, we call them dividers because they're color-coded and they're divided by the specialty, or what we call source-oriented medical records. It's what source, either the person that's generating the documentation or the category of information that is filed behind it. In the first divider, history and physical, the patient's history and physical would be filed behind it. So you would lift up the tab and you would find history and physical behind it. Even before that, we have a patient's face sheet that would, there's 3 names for it: patient registration form, face sheet, or patient information form. They're all synonymous with each other. And the name is descriptive of the information that's contained on it. There's patient's demographic information, which is patient identification information, name, address, date of birth, emergency contact person, sometimes Social Security number. Then we have financial information that's also contained on that form. That's insurance information. And that would be on top. Usually you would even find that on the left-hand side of the chart. So as soon as you open it up, you can see it validates who the patient is. It should match, obviously, the name on the outside of the chart. And then you get a profile or a face of whom the patient is. And that's why they do call it a face sheet. As I said, the first divider is history and physical. That's where the patient's past, present history, and family and social history is contained on that form. That form's normally given out to the patient in the reception room to fill out before they see the patient or the doctor on a new patient visit. Maybe it's sent through the mail or even on a website. The next divider is progress notes, and again, that would be based on the facility or the doctor's office that you might be working at. each specialty would have their own progress notes section. The doctor definitely would have his own progress notes. Never are they intermingled with any other specialty or ancillary service. Ancillary is a term used to mean secondary. It represents physical therapy, radiology, lab, speech therapy, social work, dietary. All of those different disciplines or ancillary services would have their own progress note divider. Next one is correspondence. This is any mail we receive pertaining to the patient, we would file behind the correspondence section. Lab x-ray is just that. Any lab work or x-rays would be filed behind this divider. Now, something I didn't tell you is that behind each divider, the information is filed in reverse chronological order. It means the most recent information's on top. Unlike a book where the first page represents the oldest information going to the most recent. So remember, it's not book order, it's reverse chronological. So page 100, if it was a 100-page book, would be on top. The reason why you do that is the doctor and the other ancillary services want to see the most recent information on the top. Hospital divider is the information that's filed behind this divider is information from other facilities. If the patient was seen and treated, inpatient stay, or outpatient procedures done, we would request that information from that hospital or outpatient center to be sent to our hospital so our physician, attending physician, can review it and utilize the information for the purposes of that inpatient stay. Insurance is any information we receive from the insurance company or any billing information would go behind this divider. Miscellaneous, we're going to use for consent forms. You have the HIPAA consent form that all patients sign, consent to treatment, consent for payment. The notice of privacy practices would be filed behind this for HIPAA purposes. And as you all know, the notice of privacy practices stipulates what that office or facility does with the patient's information, how it disseminates it or sends it out to other facilities, or how it uses it internally for treatment, operation, or for payment purposes. Again, miscellaneous is used for the patient consent forms. Then last divider is a divider that's blank, and we can use it for whatever the facility or office would like to use it as a specialty tab. I believe that is it, and thank you very much, and I hope this helps you in your future endeavors.